And for to get the answers of those objectives, we go for data collection methods. And so data is a simple unit of information. So it can be like for height, we can say it's in meter, it can be in centimeter, or it can be in feet and inches. So you can have different units for that particular variable. But for a variable, if we are trying to get information, it is known as data for that particular information. So what is data? Data is something which can be measured. So that is very important. If it's not measurable, very difficult for us to know and understand, and to even other make others understand. So data is something which is measured, collected, reported in different formats. It can be only shared also. Analyzed, I mean to say that you can compare between two groups, three groups, and different groups, even a same group at different time points. So you want to analyze the data so that you can come up with some inferences, and then you can present the data simply in text. You can write a text also, or if even you can make some data visualization, like making graphs, tables, images. So your next session is on the data analysis part. So how we can analyze that data and how we can present that data. So next session, you'll get that insight, that if you have data, you have collected data, now how you can better present your data. That is a quality of a researcher, that whatever minimum or limited information you have, how beautifully you can present, how simply you can present, so that most of the people, they can understand it. So data, if we talk about in terms of quantitative terms, quantitative data, it is something which is measured in numbers. And it is like, for example, I mentioned like 56% of 18-year-old, they drink alcohol at least 4 times a week, right? So what I'm telling you, I'm telling that if I talk about 18 years old adults of a particular age group, out of those group of people, 56% they take alcohol, and that also minimum 4 times a week. So different information I have collected, and I have beautifully presented it into simple one-line sentence. So this is quantitative presentation of numbers, percentages. Here I have presented in numbers. The drawback of this quantitative data is that it never tells you about mainly about why and how. So why these kids, they are drinking.
Sorry to
Well,
disturb, sir. There is some disturbance in your voice. Maybe a
okay,
network issue, I don't know. But your slide is clear, but voice there is little bit breaking.
okay, yeah, okay. So I'll try to be more louder, I think, because I'm using the earphones. Okay,
Are
so
you using headphone or something?
yeah, I'm using earphones.
Okay, I usually the earphone gives some trouble. Can you
Mhm.
try without earphone? Earlier
Without
also we have
earphones,
faced this
sometimes it
problem.
is.
Yeah.
I think now it's clear.
No, it's clear now.
Yeah, okay.
Yes.
So I was saying that when we collect quantitative data, it never gives us information about why and how. So this why and how and when, this needs some qualitative intervention, something which which gives us more insight about why this group of people, they are involved in in alcoholism or in alcohol intake. So example of quantitative data is simply, I've given some examples like height of first graders, what is the weight of sumo wrestlers, what is the duration of red light in a traffic light, what is the different, what is the mean age of Olympians, what is the distance between the planets. This they talk about numbers. So numbers, if we are interested in numbers, we go for quantitative data collection, and that is simply we can do. Then second comes qualitative part. So qualitative data is mainly about categorical data. It is something which tells about the quality of a variable, like physical trait, like gender, male, female, like different colors of skin, or different, even we can say the color of nails when the skin is pale in anemia. So sometimes we go for a quality variable, and that is qualitative data, like happiness rating, gender of a person. they are the nominal data. They are with name, pass and fail, color of iris of the eye. So that kind of data we can also collect. So data broadly, they are divided into two. One is qualitative and one is quantitative. So qualitative is mainly nominal. Nominal means name. We can't change those names. These are the names which are routinely given, like brown eyes, Hispanics, Asians, women, men, transgenders. And then second, this is ordinal data. This you should also know. Ordinal data is a data which have some order. For example, we say severity of a disease is mild severity, moderate severity, or severe severity. Anemia also, we say mild anemia, moderate anemia. So we have a continuous variable, and we have categorized that continuous variable sometimes into a ordinal format, that is known as ordinal data. So sometimes you also collect data which is ordinal, which has an order. First, between first order, second order, third order, there is a gap which is something which is defined. Then is quantitative data. We have already talked about quantitative data. It is something which is measurable, but it is also of two types: discrete and continuous. Discrete means when we don't have decimals. So we say like the number of students in a class. We can't say there are 11.2 students. We can't say there are 12.3 girls in a class. So when the number is a discrete number without a decimal, so that is known as discrete data. The number of workers in a company, the numbers of homes which runs a baseball game. The example is given. Then continuous data is something which has decimal, like height of children can be 11.2. I'll say it can be like mid upper arm circumference, height, weight, BMI. They all comes in points also, and they make sensible. They make some sense even in decimals also, right? So that is two categories of quantitative data. Then what is data? So I hope now you understand what is data. And now what is data collection? So data collection is a process in which you go and collect the information which is required to answer the research question of the exam. So here you have a research question. For that research questions, you know these are the variables on which you have to collect data, and then you go and start collecting data. This whole process is known as data collection process, and this takes the maximum time of the research. Like if your study duration period is 1 year, in that 1 year you'll say 6 to 9 months you'll give to data collection. Even I'd say more also sometimes. So the task of data collection begins when we know what is the research problem, when we know that our whole blueprint of the research we have planned, that is protocol is written, and then you get ethical approval also, and then you start data collection. So this is also important point. I hope you must be knowing that write a protocol, submit it to ethical committee, get ethical approval. After getting ethical approval, then only you can start your data collection. So this is something very important. Getting ethical approval is very important. Otherwise, you'll not be able to publish your data in good journals. So in collecting data, the researcher must decide. So these are the questions which rotates around this data collection process. Which data you want to collect? So what are the different variables? It should be predefined. How you are going to collect data? What are the different tools and techniques which are you are going to use to collect data? We'll talk in detail in the coming slides. Then who is going to collect data? This is also an important point. Whether the principal investigator he himself or herself will go, or the co-investigators will go, or there are some research staff, they will go. If you are a student, you are doing your thesis, then definitely you'll mention that you only yourself will go and do the data collection method. You may take the help of your colleagues, you may take the help of your juniors, you may take the help of your other healthcare workers who are involved. So you can take help, but it should be predefined. When to collect the data, the timing, the study duration, that should also be mentioned. So these are the questions which should be answered before you are going to start your data collection process. So what is the purpose of data collection? This is very important. This you should understand. We want to get information. We want to get data which will help us to write our results, and these results are going to answer my research question. We want to keep the record. Sometimes you just want to keep the record. You want how many patients they're coming in OPD, how many patients they are inpatients. So sometimes in hospitals, they are also there. They're not doing research, but they're collecting data. So they are keeping their records in place. If somebody comes and asks them what you've done in last 1 month, what you've done in last 1 year, so everything is there. To keep your records also, you collect data. to make decisions about important issues. Like for COVID-19, how many new cases are coming? The new cases which are coming, whether they are among vaccinated people or unvaccinated people. The new cases which are coming, whether they are with comorbidity, whether they are elderly or. So if you know that kind of information, you can take better decisions, whether to increase vaccination coverage, whether to go for a booster dose, whether to target a specific group for vaccination. So this is the beauty of data, that it gives you it empowers you to take decisions, and then to pass information to others. If somebody wants to know about, if WHO asks India, if any other country asks India, what is your data about COVID vaccination or any other vaccination, so we should have that data so that we can share that information with others. So that then also data helps. If you have data, then only you're in the position to share that information. So broadly, methods of data collection can be of two types. One is primary data, and second is secondary data collection. So primary data collection is original data collected by the research staff during that study, or primary data which is collected by the person, that is something which was not there. So you were not knowing the height, weight, and BMI of a group of people, and you are collecting data and then you are analyzing it. That's primary data. So that means when you're doing something, you're putting efforts and getting data. That is primary data. Secondary data is when the data is already been collected, published, and available somewhere. You're using the data and then trying to make out some, trying to answer some hypothesis or generating some hypothesis out of the published literature. So something or some data is already available. We're just looking at that data, and then you are saying, yes, in this particular district, the cases are more, or I have the data which says that in this particular state, coverage is good. That's why the cases are less. So if you're doing such kind of research, that times you only go for secondary data collection, and then you answer the question of your research. So how primary data is different from secondary data. So being a student, you all are students, so you will do thesis, you will do research. That means you are mainly targeting the primary data. That is you'll go, you'll use some tools and techniques and collect primary data, and then you'll write your results, and you'll present your thesis. So mainly most of the times students thesis, they are on primary data. But during COVID time, we have seen that because of restrictions in movements, most of the thesis they were given on secondary data also. Students, they have done meta-analysis, they have done secondary data analysis also because of the restrictions. So secondary data can also be used. So, but there is a huge difference between primary data and secondary data. So primary data is done in real time. It is, and we are sure about the sources because you're doing yourself. You know how you have collected that data. So you're sure about the sources from where you are collecting data. In secondary data, sometimes you're not sure whether the data which is already been available, it's like, it's from a good source or not. Then primary data can answer your research question. Why? Because you have planned for it. You know that this is my primary research question. You know that this type of data is required for to answer this question. You have kept those all variables in your questionnaire, and then you have collected data. Well, whatever will happen in secondary data, if you want to see whether in among vaccinated people, COVID cases are down or not, if you're taking secondary data, you may find sometimes age is missing, sometimes male is gender is not mentioned, sometimes comorbidities is not mentioned, because that is done in a by somebody else who was doing his work, who was not focused to have the data which can answer our research question. So secondary data is sometimes they do not give all the data to answer your research question. So that's why I have mentioned that refining the research problem. You have to refine the research problem. You may answer or you may modify your research question. Primary data takes more cost, involves more cost and more time, because you have to do it. You have to start from zero. You have to start from a scratch, and then you have to build up your data. Right? So it has more cost and more time. However, secondary data is cheap with no time. You can get a PDF, you can get an Excel sheet pulled out from a survey, and then you can analyze it. Right? Primary data avoid bias. Why it avoid bias? What is bias? Bias is a systematic error which is incorporated inadvertently by the researcher in the research. So if I am doing something and by mistake, I mean, without a bad intention, without a wrong intention, I am doing some wrong data inputs. So this mostly happens in case of secondary data. Primary data, you know that you have to always measure the height using a standard stadiometer. So you'll try to get the correct information. The introduction of bias, the chances of measurement bias, the chances of other biases are less when you're doing a primary data collection. Primary data collection is more flexible. Why more flexible? Because at the time of collecting the data, you may do some modifications. You may see whether the questionnaires need to be put up and down, whether you want that something else should also be asked. Even sometimes you can get major changes, so that you have to inform your ethical committee also that these are the two four more variables which I want to include in my study, because now I think they're looking very important, right? So you are more flexible when you're collecting primary data. At the time of secondary data, no flexibility, because whatever is available, you have to bear with that only. You have to answer your question with that available data only. So how we can collect this primary data? So primary data can be collected only by observation, only by looking at something, seeing, and then saying, yes, this is available, this is not available, this is happening, this is not happening. So it can be only by pure observations. Then second is surveys. We all know there are many health surveys. There are district level health surveys. There are national family and health surveys. There are census. There are many things which are going on around by done by different organizations who collect data from the community. Right. So we can also collect primary data by doing surveys, going in community, going in a village, and doing a survey. We can collect data by interviews. We can collect data by questionnaires, schedules. So these are the different methods or different approaches by which we can collect primary data: by only observing, by doing survey, by doing interviews, by using a questionnaire, by using a schedule. So we'll talk now these all five approaches in detail. So observation is when the data is collected from the field with the help of only observation by an observer who is personally going to the field. I'm visiting a primary health center, and then I'm collecting information by observing what is happening in primary health center. Or I'm visiting a village health and sanitation committee meeting, and then I'm observing what they are doing, how many people there were there, what activities were performed, and just jotting it down. And then I'll come up with some primary data on the functioning of primary health center or the functioning of village health sanitation and nutrition committee. Right. So this is the approach in case of observation. So what? So we know that what is we determine what needs to be observed. We should know that we have planned in our protocol only that this data is required, and this is what we have to observe. For these particular points, we have to collect information. Then we select participants. That means that if I want that only ANMs should be there for observation, only ASHAs should be there for observation, only a particular disease patients include in the observation. So they can be randomly selected. If you're doing a study which is where you're doing sample size calculation, where you're using sampling technique, you may go for a random selection of people also. And sometimes we go for convenient sampling, or first come first included in the survey type of approach can also be. Then you conduct the observation. You decide a venue, decide the duration. You may use a recording material also. You may use a checklist also. You may take the photographs also. And then finally, on the basis of all these observations, you get all the data which is required. And then you compile the data, and then you analyze, interpret, and write the result and submit it. So this is how you collect uh, information by observation as a primary data. So types of observations can be structured. If you have a fixed checklist: facility for drinking water available or not, toilet facility available or not, patients they given up, they were the weight were taken or not. So if you have a fixed checklist for your observation, then you have a predefined checklist. You will do a careful observation, and everything whatever was required will be, what the data will be collected by using that checklist. Unstructured is when you go unprepared. You are not planning anything. You feel like there are few experts in this particular area, and they can go themselves and they'll do the observation, they can do the inspection, and then they can come up with their findings, and then we'll collate the information from all these experts, and we can have the idea about the functioning of a particular healthcare center. So that can also be done, but that is unstructured, that is, I'll say, not that standardized. Then uncontrolled observations and controlled observations. So these are in different situations. Controlled is when you have that is not the real time situation for a particular place or a particular spot. So when the people, they are not in the real time, and then that time you're collecting or you're observing, that is known as uncontrolled observation. Controlled is when you have informed, mainly in the experimental study designs, you have a controlled setting. When there is a controlled setting and then you are observing something, that is known as controlled observation. So it depends upon the setting, right? So observation has its own advantages, like it produces a large quantity of data that you can observe anything which you want. It's easy and simpler to do. All data obtained, that can be used. Observation and techniques, they can be stopped and begin at any particular time point, and this is relatively inexpensive. But when you want a people or an expert or someone who can go and do observation, you have to do extensive training. You want that different people, they are observing same thing. So uniformity of information should be collected. Observation should have uniform findings. Then extensive training is required, and sometimes you get limited information if you missed out to mention that to those observers. Then second way of collecting primary data is doing surveys. So cross-sectional study design, you might have studied all the type of study designs. So the most simpler one is cross-sectional study design, which is also known as surveys. So survey can be done to collect the primary data, and this is mainly done by some agencies also, but it can be used as a tool for smaller researches also. I mean, for your thesis also, you can do small survey or a small cross-sectional study. So how to collect primary data information through survey? So when you are only observing, here you're only observing. So that is observation, which we have already studied. But when you get information by asking, if somebody is asking you something, or you are going and asking something and getting information, that is survey. So survey is mainly done when people go and they get information from the people, asking the information, getting the information, that is known as survey. So conducting survey means you know what need to be asked, and then you go and ask from the people, and then you get the primary data. So survey method is a technique of gathering information by questioning people. It can be by using a questionnaire. So survey is a technique, and questionnaire is a tool. So you can use a questionnaire also. You go and question the individuals, and you try to get the answer of the research question which is there in your study. Then you can use through standardized question or questioning procedures can be used, with the aim of studying the relationship among the variables. So if you are asking two or three things, two or three variables, which can be compared with each other also, right? So it can be descriptive type of questioning, or it can be questioning where you can make different subgroups, and then you can analyze between the groups also, relationship among the variables also, and collecting information that will describe the whole population. So you're doing a survey of a village, trying to know about their current nutrition status. So you're asking some questions. In those questions, after that survey, you'll describe the nutrition status of that particular village, and then at the end, you may say those who are among the high socioeconomic status, they have a better nutrition, or those who have poor socioeconomic status, they were having more stunting, more wasting, or more undernutrition type of parameters. So you can compare also. So it depends upon the variables, or depends upon the objectives of the survey, that by what objective you are collecting the information. So by questioning people using a questionnaire, you do survey. Survey is also a method of data collection for primary data. So there are different methods of conducting survey. So in COVID time, you might have seen, you might have filled also, you might have done also many surveys in which online Google Forms they are used. So people, they are circulating those forms to their those who are fulfilling their inclusion and exclusion criteria, and then they are sending those questionnaires to these people, and people, if they're getting time, they're filling up those questionnaires, and that is known as online survey. So you're not directly going and talking to those people and getting information, but through online form, you're doing an online survey. So survey method can be a telephonic survey. That means you're calling people. You have a list of people to whom you need to call. You may do random selection, or you may go for universal sampling, asking everybody the same questions, or you may do a subgroup sampling of subgroup people also you can target, and then you call them and use a structured questionnaire, and then you ask them questions. So that is known as telephonic survey, getting information through telephone. Then second method is personal. Personal is one to one, face to face. It can be in home, visiting people. It may be at a particular site, like going in a hospital, doing survey among doctors, among nurses, going in a college, doing survey for among students, or it can be sometimes known as computer assisted personal interview. So this is like I have a tab. In that tab, I have all those questions. So I'm using something which is computer assisted. Same method, not using pen and pencil, but using a computer assisted tool. So that is known as computer assisted personal interview, but it is always face to face. Then third is electronic, through email or through internet or through different softwares, Monkey Survey and other softwares you can use, so that you can get information about your research question. So then third is interview method. So we have talked about observation, we have talked about survey. Third is interview method. Interview method is for collecting data is by, as you can see in the picture also, it can be one to one, one interviewing many, or many, or it can be through verbal responses. So what is different in survey and interview method is that when you are interviewing questions, you can give verbal stimuli to get verbal responses sometimes. So you direct the interview. So you have an interview schedule with you, and you use interview schedule that these are the different points on which I'll try to get the information for the interview. So questions, they are asked personally directly to the respondent. And in survey, sometimes you can give questions also to people. Like this is the question, they can be self-administered. So approach can be interview, approach can be self-administered. So always remember, whenever you're thinking about data collection approach, there should be two things in your mind. What is the tool and what is the technique? So interview is a technique. Tool can be a questionnaire, can be an interview schedule, right? So you should be very clear in that thing. So interviewers ask questions to respondents, which are aimed to get information which is required for the study. So you have a schedule. On the basis of that schedule, you try to conduct the interview. So prepare an interview schedule, that in what flow your interview will go, so that you don't lose. Sometimes when we start discussing, we may lose track. So it should not happen. So there should be an interview schedule in your hand, so that whatever you are asking, you may record it also. You may record it, or you may write it down if you're quick enough. Then select study subjects, key respondent. This we go with inclusion and exclusion criteria for our study participants. It is well defined in the protocol. Then you conduct the interview, use your interview schedule, and then you collect the information. And if it is for a quantitative purpose, then you may get simple quantitative data which can be analyzed. If it is for a qualitative study design, then you may get different verbatums. So there are different statements which are given by different people, and you can find out which statements they are common and which statements need to be highlighted by going through all those transcripts. So you have to analyze and interpret the data which is collected from interview. So interview methods can be structured, or it can be unstructured also. Structured means when you have pre-decided questions. Schedule means that you have schedule is to take care of the flow of the interview. And structured interviews when you have pre-decided structured questions which give you clear-cut answers. Unstructured interview when you don't follow a predetermined questions. You know the schedule, but you're not going with predefined questions. Right? So this makes interviews also structured and unstructured. Then third is focal focus group discussion. This is very important. It's a very important tool for qualitative study designs. So as the example which I've given, that 56% of the 18-year-old adolescents, they are involved in either taking four drinks in a day or in a week. So that was the information which is collected by a quantitative tool method. Focus group discussion among adolescents with a moderator, with one recorder, with the interview schedule will give you a better insight about why and how they are involved in this substance abuse or this in alcohol abuse. So if you want to understand this alcohol abuse use disorder in depth about why these people they are involved, then you should go for focus group interviews or focus group discussions. They are structured, they are free flowing, sometimes they're semi structured also. You can get up new ideas also during that discussion, that yeah, this is something which is coming up new, which was not there in the schedule, and you want to discuss it more, right? So it is sometimes structured, semi structured, free flowing. There is one moderator. Why we need moderator? We need moderator because we want that there are a group of people who are sitting together. Everybody should get a chance to speak, because we know that in class also there are few students who raise hands and they always keep on speaking more than other students. So we want everybody should get chance. So if everybody should get chance, then this is the responsibility of moderator, to take care of the flow of the discussion also, and to take care that one is not speaking too much or one is not silent. Everybody is speaking, everybody is contributing. So this is the role of moderator. Then there is one recorder who records everything. Why we record it? Because yeah, sometimes you're so much into the discussion that you don't write down everything. So if you are in the so much into the discussion, you don't want to get distracted, record it, and later on you can listen it, and then you can write down your transcripts, what was it actually discussed. So moderator maintains the control and focuses the discussion. It should ideally involve, I'll say it should ideally involve 6 to 10 people, but sometimes they can be more sometimes. And group interview starts with a broad topic. We always start with a broad topic. If I'm talking about suppose family planning, so you can start about the population of India. India is the second populous country. You can talk about China. You can start with China. You can start with world's population. So any broad topic you can take and then come to your specific topic later on. So this is how you involve everybody, right? And the group should be homogeneous. Why this is mentioned? Because if group is not homogeneous, if suppose there is one pradhan sitting over there and there is one person who is not that important from the village is sitting together in a focus group discussion, you may find that that person will never speak up, because pradhan is sitting over there, somebody who's the higher status is sitting over there, he may not. So the group should always be homogeneous, so that nobody should have a restriction. Like if daughter-in-laws are sitting, then avoid mother-in-laws there. If mother-in-law is also sitting along with daughter-in-law, they may not speak up about if something you're talking about domestic violence, or you're talking about nutrition in the family, you're talking about the rights of women in a family. So that the group should be homogeneous, so that everybody they feel comfortable in talking and sharing their views. Similar lifestyles, similar experiences. Like if I am there in a focus group discussion with somebody with 20 years experience as a professor, I may not speak up that much, because I'll be having so much of respect for that person, or so much of I mean, so experience also matters. So whenever you are doing a focus group discussion, try to have a homogeneous group with similar type of lifestyles, with similar type of experience, so that everybody feels at the same level and they feel comfortable in talking, comfortable in sharing their views. Then generate discussion and interaction. That's very important. Everybody should be interacting. Listen to what people have to say, give time. Sometimes some people they take time to speak up, so give time, and everybody should get a chance to speak, right? So this is, I think this is the best technique. This focus group discussion is the best technique to get the answers of some qualitative questions. Then there are some clinical interviews. There are also simple interviews. And why the word clinical interviews is used? Because at this point of time, you're mainly collecting information which is more clinical, which is like clinical symptoms, investigations, radiological findings, biochemical parameters. monitoring, diagnosis, planning for treatment. If such kind of information you are collecting, then we call that interview as a clinical interview. So what are the advantages of this interview method? So there can be a single one-to-one in-depth interview, and there can be a group focus group discussion also. So the advantage is when you do these in-depth interviews, when you do these focus group discussions, you get more information in a greater depth, because people, they are free to speak out, and they sometimes say what we don't know, right? Otherwise, in structured questionnaires or in quantitative, we always ask only, you drink or not? Yes. What, how many times you drink? What is the frequency? What you drink? So that will not give you the most important cause, or behind that drinking problem. Then resistance may be overcome by a skilled interviewer. If an interviewer is very skilled, if there is resistance even from a group of people, he may overcome that resistance. He may involve those people. He may make them to speak, right? So this interviewing skill comes with time. After practicing, after doing many interviews, you may feel more comfortable, more skilled to do such interviews. And even personal information can be obtained when you're sitting in a closed group. When you are doing one-to-one in-depth interviews, you can get personal information which you can't get by doing observation, or by sending online questionnaire forms, or by doing surveys. So at that times, these personal interviews, they are very important. Disadvantages, it's an expensive method. You have to go one-to-one. You have to go spend your time, spend money, getting everybody together, and then having somebody to record, writing. So it's expensive method. Then two bias which can be introduced, which can be there. There are interviews bias and respondent bias. Interviews bias is, everybody is not same, do not have the same skills of interview. So there might be, you may feel like uh, our interviewer is by himself getting in a flow and getting out of track and missed some information, or he himself is having some own thoughts like this can happen, and he's getting that bias introduced into the results. Respondent bias is sometimes people, somebody speaks, somebody don't speak, somebody they have different limitations, so even getting information, correct information. So bias is something which is incorrect. Bias is getting incorrect information into your data. So if you're getting data incorrect by the fault of interviewer bias, if you're getting incorrect data because of any reason from the respondent, that is known as respondent bias. And it is also time consuming, very time consuming. Doing is also time consuming. I'll say planning is more time consuming. Planning, focus, group discussion take a lots of time. Then conducting may take 1 hour. But after that, listening to that recording, writing down whatever they have said, understanding again, recalling again, then writing it down, and then reading all the statement, highlighting the important statements, and writing the results. It takes a lot of time. This is time-consuming process, but it gives you beautiful results. It gives you the results which are really important for people to know, for policymakers to know that this is the basic problem in the society, and how we can solve that problem. So this is something which is, I think, important for you all. Being student, you'll all end up into making a questionnaire for your research. So whenever you do a research, it's mostly quantitative, and for quantitative data collection, you need a questionnaire. Even for age also, you need a questionnaire mentioning name of the person, age of the person, gender of the person. So to collect the information, you always develop a questionnaire. So you have a questionnaire, which is a tool. It's an instrument for collecting data. This is in the written format, and it can have open-ended questions. It can have closed-ended questions. Open-ended means when you have fixed responses. When you say, do you smoke? So answer is yes or no. Yeah, how many cigarettes you smoke? And answer is 10 cigarettes per day, more than 10. So it can be open, or you can keep it open also. So if you're keeping it open, then it becomes open question. If you're giving options, fixed options, where a person cannot write anything in between the options, that is closed question. So questionnaire can be sent by mail, in surveys, or you can do a survey by online survey, or whatever questionnaire can be used, or questionnaire can be used to do interviews also, right? So you have to print it out, and then you have to go to each individual participant, each individual study participant, who fulfills the inclusion and exclusion criteria, and then you use that questionnaire. So steps again same. You have to prepare a question. So you know that what information, what variables should be there in a questionnaire. So you prepare those questions. You select your respondents. You find out the way of to administer the question. It can be self-administered. You can even ask and fill on the behalf of that study participant. Then you get the information, do the data entry, make tables, analyze, and then interpret the data. So this is how your questionnaire is used to collect data and to write the results of your research. So questionnaire, they may have open-ended questions. We have already discussed open-ended is when the person, the respondent can write in their own words. And closed-ended is when you have given responses. There are fixed responses. There's only tick mark. So that can be a dichotomous question. That can be a multiple choice question, but choices are fixed by you, right? So when they are fixed by you, this is closed-ended or fixed alternative questions. And open-ended question when respondents they have the freedom to write in their own words. So what are the essentials of good questionnaire? So after making your questionnaire, you just go through on these points so that you can have an insight whether your questionnaire is perfect or not. It should be short and simple. No need to write big, long sentences. Keep it short and simple. Follow a sequence. Sequence is very important. What you are asking first, what you are asking next. It should make sense, right? So that a person doesn't get bored and find it logical also. So there should be a good sequence. Technical terms should be avoided. It should be very simple terms. Instead of asking anything which is more technical, ask something which is more common, more simple. Should provide adequate space for answers. Like if it's a self-administered question and you know that answer can be long, give enough space. To save the paper, don't give only a one line when you know that answer may need 3-4 lines, right? So give enough space to answer. Otherwise, people will not be able to write it also, or may get irritated also, or you may not get the right information. Then directions to fill the questionnaire should be given. Like, if you want that, you have to take it, you have to do all the questions, something like that. Like in your question paper also, they say there are 200 questions, all are multiple choice questions. Every question should be answered. There is negative marking or no negative marking. So everything, so such kind of information, directions, if they are important, should be mentioned. Physical appearance of that questionnaire. If it's a self-administration, should be good quality of paper, good color. Font size should be readable for everybody. But chota chota लिख के दे दिया, and if the person is elderly, not able to read, then it's useless, right? So quality of paper, color of the text, size of the font, that should also be taken care of. And sequence should be very clear. And what should they fill first? Then comes advantages of the questionnaire method. So questionnaire is low cost, even when the sample size is more or widespread, even it's always low cost. Free from interviewers bias. Sometimes if you're not asking and by your own, so interviewers bias goes off if you have closed-ended questionnaires. Respondents, they have adequate time to think. If you're given the questionnaire, you're given them time. If you're given them 1 hour, take this questionnaire. You go in a class in a school and give all the students some questionnaire and tell them that you are having 30 minutes to fill. So that means they are getting enough time. You're not rushing through when you're taking, like you're doing interviews. So respondents who are not easily approachable, people who are not, if it's very difficult to get them to speak, so at least they can also be reached conveniently. They may not speak to you, but if they have a questionnaire which has fixed answers, they may take it down and you can get their responses also. And large samples can also be used for questionnaire because it is easy to do. Disadvantage is it's time consuming. Why? Because if the sample size is large, every time you have to go give questionnaire, it will take time. The respondents need to be educated and cooperative. This is very important. If it is written in Hindi, even in the local language, if the person is not educated, then he has to be out of your sample size, right? So respondents need to be educated to read that question. If it's a self-administered question, otherwise you have to help the person by reading, making them understand, and then answering. And they should be cooperative also. The method is slow, time consuming, that's why I mentioned, and possibility of sometimes unclear replies also. If you're distributing the questionnaire and then collecting, you may end up into getting some answers which are not clear. Handwriting is not clear. What they mentioned doesn't make sense. So sometimes there may be some missing data also. This is very important slide. Whenever you do make a new questionnaire, if you are using a questionnaire which is already validated, like I'm using a questionnaire for depression which is already validated in India, and I'm using for that for Indian population, it's a validated questionnaire, then no need to go for any validation. But if I'm making a new questionnaire for depression or for any health related condition, then I have to validate it. So how to validate that question? These are the steps. So I'm not going into detail, but I'll make you understand how to do that. So first is content validation. So content validation means that whatever you have mentioned in the questionnaire makes sense. Whatever you have mentioned in the questionnaire is adequate. Whatever you have mentioned in the question is relevant. So this who will tell us whether everything is relevant, adequate, correct or not? Experts. So you can identify 3 to 5 experts in that particular field. Like if I work on hepatitis. So I know people who work on hepatitis from last 20, 30 years. If I'm developing a questionnaire of something related to hepatitis, I can develop that questionnaire. I can send that questionnaire to these 5 experts and wait for their reply. And they'll send me their reply back about uh, each question, each item. We use the word item. So each item of that questionnaire, and they can mention that this item is correct. Answer you'll get right. This question is also correct. This question is not correct. You have to modify it. The sequence is not correct. You have to change the sequence. So such kind of inputs from the experts help you in improving the content or making the best of the content for that question. So this is done by external panel of experts. You can send them the questionnaire, and then you can, they also know content validation ratio can be calculated. And then the content validation ratio is very simple. It is like how many of the experts you have sent the questionnaire, out of how many, the total experts, how many they said it's valid question, right? So if out of 10, 8 said that valid, so 80% of the content validation ratio for that point 8. So it's well acceptable. Right? So content validation is done by external experts. Then after that, you go for pre-testing. So pre-testing is you go and identify the participants, study participants, which fulfill your inclusion and exclusion criteria. Pre-test that question. Why pre-testing is important or pilot testing is important? These both steps, they are important to know that the information which you are getting from the participants is the same which you thought of by getting by using this questionnaire. So if you are filling the questionnaire with the participants, and sometimes you may find out that the question is not making sense. Whatever you are written is need to be more simplified, or whatever you have written is the person is not able to understand it. The sequence is not good. So same, refining, you're refining. So this is for the construct validation by using this pre-testing and pilot testing method, that whatever the flow and the questions which are there in the questionnaire, whether they are correctly placed or not, or need some modification. So after pre-testing, you again improve upon your questionnaire. So first content validation, then construct validation by pre-testing, piloting, and then comes structure validation. Structure validation means when you know that there are many questions, there are many variables which have high intra correlation. They have high correlation, which are very much related to each other. So sometimes you feel like which variable you should keep, or you need to make a combination of that variable. Like if I'm taking height and weight separately, whether I have to take height and weight separately, or I have to take only BMI. So as we do multivariate logistic regression analysis, so regression analysis gives us, uh, at the end of the research, regression gives us that out of 5 variables which are significantly affecting your dependent variable, which are the independent variables. So you check for confounding. Similarly, this exploratory factor analysis is a type of regression analysis which helps you to understand that the variables which you have included in the questionnaire, out of these 5 variables or 20 variables, which you should keep, which you should remove, or which you should merge together to make some score, and they can come together. So this is known as structural validation. This you can also do, and then you can do reliability testing. Reliability testing is done by again testing among the participants. It can be done by two different people to know inter observer reliability, or can be done by you only twice in the same individual or in different individual, to know whatever results you are getting is same as you're getting previously. So reliability means repeatability, that it should not get different answers. The same question should not get different answers different time at different time points. So when you follow these all process, then you say, yes, my questionnaire is now validated, and this is a validated questionnaire, and you can mention this in the results, in your results, that how you have validated your questionnaire, and now then you have used this validated questionnaire to collect the data collection. Schedules, they are very similar to questionnaire. Their questionnaire and schedules, they are almost similar. The difference is when we make a schedule, this is mainly for research staff. So we make, this is different from interview schedule. Interview schedule was to keep the interview in the flow. This is a schedule which is given to a research staff, and we want them to go in field and collect data and collect information, right? So schedule is something which is very much simplified, and it's need a very rigorous training of this research staff, so that they can go and they can administer this schedule in the field. So schedule is similar to questionnaire, don't get confused. So questionnaire, so let's try to understand what is the difference between questionnaire and schedule. So questionnaire is generally sent through mail and no further assistance is required, but schedule is never sent to mail. It's always by a research staff. So we make a schedule, and then we have a trained research staff to fill that schedule. Questionnaire is a cheaper method. This is costly because it's always need a field activity. Non-response rate is high in questionnaire, because if you're sending by mail or something, then non-response rate is high. But when you're individually, personally going, then non-response rate drops. In questionnaire, it is not confirmed that the expected respondents, they have filled the answers. We don't know whether it is filled by him, her, by her children, by his children, by anybody else, because we have given the questionnaire and then we have collected it, or online it is being filled, right? So we are not sure. But in schedule, a research staff who's trained to fill that schedule, he himself goes or herself goes and get that schedule filled. So questionnaire is a very slow method, and it's sometimes maybe incomplete and wrong also. Information may be more also. There is no personal contact. It's depends upon the quality of questionnaire. That's very important. That's why we do validation of the questionnaire. Questionnaire can be used only when respondent is educated and well cooperated. Because if they are educated and well cooperated, then only they'll be able to understand that questionnaire, and they'll be able to answer that question. Schedule, on the other hand, schedule is information is collected well on time, because we have a trained staff who is doing it, and it depends on the honesty of enumerator. Enumerator is also the word which we use for these data collectors, and sometimes in India, I've seen sometimes we hire third agencies also. I mean, some agencies also to collect the data. If I want to do coverage evaluation for a vaccine, government wants to do coverage evaluation for a vaccine, we may hire a different agency who have staff. We can give them money and questionnaire, I mean schedule, and then we can ask them go in field and get this schedule filled and give us the information back. So we can hire agencies for data collection. When we hire agencies for data collection, we don't trust them. We trust our schedule, which is well defined, and we trust the trainings which we have planned for the research staff. And then we feel like if they'll go and collect the data, it will be a valid data. So there is a direct personal contact, relatively, which is more correct and more complete, and information can be collected even from illiterate ones. Why? Because the research staff is trained enough to make all the questions, all the points mentioned in the schedule, to explain everything to the person, and then he can get the answer, and then he can fill the schedule on behalf of that illiterate person. Then comes secondary data collection. This is very important, and this is very much doable. So I'll say if a student is involved in a primary data collection in a thesis, they may think of doing some secondary data collection also, so that you can have more publications, more paper during the same period of time, maybe related to your thesis only, right? So if you're doing a thesis on immunization, so you may get the data of NFHS 5, see whether immunization have any relationship with any socio-demographic factor, immunization have any relationship with any geographical factor. You can make a GIS plot by using that NFHS data. So secondary data, getting that secondary data is very easy. It's easily available, and you can even involve people, other people also who are trained in doing secondary data analysis. So secondary data is data analysis is very easy. So collecting secondary data, I think this is something which is my suggestion to all senior peoples also, that we can ask our students to do one thesis, one project which is on primary data analysis, and similarly in line with the same project, they can do some secondary data analysis also from the available secondary data sources. So data is gathered and recorded by someone else. So this is known as secondary data, which is not collected by me, but it is collected by someone else. So that's why it is secondary data. So secondary data is collected for another purpose. This is very important. Second point, it was collected for another purpose. Now I want to look into that data with some other research question. So if there is a survey to like if there is a survey to see what is the prevalence of hypertension in urban population, and it was published. Now I'm using that data to document what is the burden of metabolic syndrome also, because they have also mentioned triglyceride, cholesterol, and other parameters which are required to talk to answer the question of metabolic syndrome. So the data was primarily collected for hypertension, but now I have the access to that data, and I want to answer that what is the prevalence of metabolic syndrome in that particular population, whether even I can find out or document the risk factors for metabolic syndrome, right? So this is how we get secondary data and try to answer the research questions which are different, which are different from the primary objective of that secondary data collection. So it involves less cost, less time, less effort. You just need to have a research question in mind. You just need to have access to the data. You just need to know how to analyze data. Then secondary data is data that is being reused. It is usually reused in different contexts. And it can be collected from a book, it can be collected from a census, it can be collected from NFHS reports 1 to 5. Even Excel sheets are also available. It can be collected from journals, it can be collected from books, magazines, newspapers, libraries, internet. So you can find out any source and then you see the data, try to interpret that data, and try to answer if you have a research question which can be answered by a secondary data. Other sources of secondary data is publication of central government, state government. There are different surveys which are done. I have mentioned that district level health survey, NFHS survey, SRS survey. There are many surveys which are done. Technical and trade journals can be used, books, magazines, newspapers, publications, reports, public records. Anywhere, wherever you try to find out, you can find out. Even sometimes they mention published and unpublished data. Even people, they go and try to find out unpublished data from different theses which are not published, from different authors who are working or who have worked but not published data. And that's difficult, but we should try to get all the data possible for to answer our research question from secondary data. So we should consider what should be considered. Reliability of data is very important. That who have collected the data, why they have collected the data, what time, at what time. It should not be very old. It should not be very old so that it's outdated, and what methods they have used. So these things should be answered first before using the data. Suitability of data in terms of scope of your primary objective which you're planning to study should be, so the data should be suitable for your to answer your research question. Adequacy is very important. What information you are desiring for your research question, it should be available. So whether the data which is available in that secondary data set, it is adequate or not, it's having adequate information or not. Advantage is easy to access, low cost. Clarification of research question is very important because sometimes you had a clarity that this is what the research question need to be answered. So and then you have a secondary data, that can be answered. You may answer even multiple research questions also from a secondary data. Sometimes you do secondary data analysis and you may come up with different ideas also, that that other things can also be, we can also do other stuff. Even my suggestions to all students is, sometimes we collect data for our primary objective, analyze it, submit our thesis, publish our paper, and we do not relook at it. You should also relook the data, and sometimes in the same data you may find out that you can answer different research questions also from the same data. That also gives a good opportunity to publish. Disadvantages: quality of research is doubtful. It is not, may not be specific for the need of whatever you are need. There might be incomplete information, many missing values, missing data, and it may not timely also. The data which is published 5 6 years back may be outdated data also. So I talked about reliability and validity in my previous slides also. So reliability means repeatability. So when normally we say instruments also, that whether they are reliable or not, even the data whether it's valid or not. So validity means accuracy, how precise you are. Reliability means repeatability. So this is the best example to make you understand. In this first bullseye, you can see that all the data which I am getting, all the information which I am getting, it's randomly distributed. That means it is not repeatable. I'm not getting the same information every time. So this tool, from where I'm getting this data, has low reliability, has low repeatability, and low accuracy also, because accuracy is in center. This is the bullseye. Ideally, it should hit the center. If it hits the center, I can say it's valid, accurate, right, and precise. But it's not reliable, or low reliability, low accuracy. Here, when I'm using this tool, I'm getting all the results very close to each other, but far away from the bullseye, from the center. So it has low accuracy, low validity, but high repeatability. So this tool is still better. What I can do, I can have some correction factor. I can, like, suppose it's a BP instrument, then I can have some correction factor that if whatever systolic blood pressure is coming, -2 can make me reach to this valid point as per my gold standard. So I can have some correction factor and can use this tool also, because it has at least good reliability, good repeatability. And this is the best one. This is the best one with high repeatability and high accuracy. So our tools, our questionnaires should give us results like this. Valid results means truth. We want truth. So we should get the truth, and we should get the truth every time we use it. Right. So this is high repeatability and high reliability. So this is my last slide. The selection of data collection tool. It's depend upon the nature, scope, and objectives of your data collection. So if you think about what exactly you want, you should know what you want. Then only you can plan about what is my data collection. So data collection we do after the protocol and ethical approval when we get, but everything about data collection approach should be mentioned in your protocol. You should know beforehand that these are the tools which you're going to use, and this is the technique which you're going to use to collect data about each variable. You should go one by one for each variable, make a chart, make a table, put the variable name, then tool and technique. Age, tool is questionnaire, technique is by interview. So similarly, blood pressure. So tool is BP instrument, and technique is by taking 2 readings or 3 readings and then taking average. So this is how you, if you plan your data collection method, then you'll never fail. You'll always get a good data which will give you valid results. It also depends upon availability of funds. If you have good enough funds, you can have research staff, you can train them, let them go. You can have you can even go for a larger sample size. More the sample size, more valid, more precise results we get, right? But ideally, it should be adequate sample size. Then time factor is very important. If you don't have that much of time, then you go for simpler methods. If you're good enough of time, you can go for complicated methods. You can go for in-depth interviews. Sometimes you might have studied in the research designs also. That research designs, there are mixed method research design. Mixed method is when you do quantitative and qualitative together. Sometimes it can be sequential also. You do a quantitative analysis, you know, like that this group of people, they are involved in this type of habits. Now you can plan a qualitative research and you can find out why they are involved in that particular behavior. So quantitative plus qualitative, but is it possible? It is feasible for you to do both type of approaches together? Depends upon time, depends upon funds, depends upon your objectives also, and then how accurate you want to be. You have seen that different tools, they have different accuracy. So more robust tool, more accuracy, but more funds, more time taking, more resources they are required. So depending upon these points, you can think about that which data collection tool you should use to answer your research question, which data collection methods you should use so that you can get the best data to answer your research questions. So thank you all, and I'll be happy to take any research, any questions.
Thank you so much for the comprehensive presentation. And now we'll move to the questions. There are a few questions in the Q&A box. We'll just say it. So Vijay Lakshmi is asking that whether focus group interview is effective for quantitative studies or qualitative studies.
It is only and only for qualitative studies. So when you want to find out the answers of some difficult questions which are not answered by quantitative numbers, then you go for qualitative analysis. For example, like if I talk about hepatitis B birth dose, hepatitis B birth dose coverage should be 90%, but it is around 50%. And I know that it is 50%. I know that people who are the newborns who are born in institution, who are getting institutional deliveries, they are getting birth dose, who are getting deliveries at birth, home births. They are not getting ANMs in an area where the supply of vaccine is good. They are giving birth dose. So I know terms. In quantitative terms, I know that hepatitis B birth dose coverage is poor, and these are the factors because of which it is poor. But still there might be some other reasons which I cannot get from quantitative method. So what I'll do a focused group discussion among mothers and healthcare workers who are involved in this hepatitis B birth dose services, and then I'll try to find out what difficulties these healthcare workers are facing in giving hepatitis B birth dose, whether they feel uncomfortable in giving intramuscular injections to a newborn with a small muscle on thigh, whether the family they're hesitant in getting that vaccination given to a newborn who's very small. So in this focus group discussion, you may come up with many different reasons also, different causes or factors behind this poor birth dose coverage. So focus group discussion is mainly for qualitative research, and it's the best tool for qualitative research.
Yeah. Thank you, sir. Now, there is another query by Ganga Prasad. He's asking that during data collection, sometimes the samples, they are not ready to give the valid answer for drinking and smoking. So how can we collect the proper data? I think he's asking regarding the authenticity of the data.
Right, that's true. This happens. This is something which commonly happens when we talk about their income, when we talk about their personal habits. So that's why I said it's the skill of an interviewer, that how comfortable you can make them feel. There should be there should be audio and visual, I'll say, privacy also when you're talking to them. Like say I am sitting in OPD and then one patient is sitting over here, two are standing, door is open, three are listening outside, they're also standing. At that time it's very difficult to get the right answer. So privacy, take care of privacy, counsel them properly, make them understand that why you are asking those questions. Sometimes people, they feel like if I'll tell I'm involved in bad habits, maybe I'll not get some benefits of different schemes and other things. So sometimes that's why also they lie. So make them comfortable, make them understand. That's why that patient information sheet, patient consent form is very important. That give detailed information that why you are collecting data. Make them understand that this is important to know that what he is involved into. and this is not going to negatively affect him by any scheme or any other things, and he should feel have that privacy, and he should have that confidence in you to tell. So difficult to get, but I think it's doable.
Yeah, it's true that really we have to make them comfortable, and we have to have a good interpersonal relationship with them. Only then they will come out with the original answers. Okay, another question is that what is the difference between structured and semi-structured questionnaire?
Structured is when it's completely structured, like everything is mentioned structured, even I mean from first questions to last question. Unstructured is when first to last is all unstructured. Semi-structured is when it's have mixed unstructured and structured together. Then we use the word semi-structured.
Another question is, so what is the difference between schedule and interview?
So schedule is the name of the tool which is used by agencies when we hire research staff, train them, and want them to go and collect data. So suppose a 12th pass or a healthcare worker, I want them to fill the questionnaire. So I'll try to make a schedule which is fixed, which is simple, which is easy to do, and that is the schedule. What is it? Interview is a technique to which can be used to fill a schedule also, which can be used to fill a questionnaire also, which can be used to get in-depth qualitative information also. So interview is a technique, schedule is a tool which is used, which is similar to questionnaire. And sometimes we use the word interview schedule. So interview schedule is a guideline so that you do whenever you're doing an interview, it should go in a proper flow. So slightly confusing, but I think these are the three points.
Okay. So another question by Mamta, what is the difference between focus group interview and structured interview?
Focus group discussion is, I clearly mentioned that slide, that you have a group who are focused towards one cause. We have a moderator, we have a recorder, they sit together and then they plan it. So you can have a structured schedule for that focus group discussion also, that I'll start with broadly talking about hepatitis B burden, then I'll talk about hepatitis B vaccination, then I'll talk about 3 doses which are easily given as a pentavalent, then I'll talk about mother to child transmission, then I'll talk about the role of birth dose in mother to child transmission, then I talk about whether you given up to your child or not. Like this is so structured, anything can be structured, right? So a focus group discussion can also be structured. So a questionnaire can be structured. So when you have a structure of anything, we use the word structured. But FGD, focus group discussion, is the name of a technique which is the best technique for qualitative research.
Yes, sir. I think there's one more question just a minute. With what statistical data you can say that the tool is reliable and valid?
There are methods, like I mentioned, exploratory factor analysis that can also be used. Then there is content validation ratio that can also be used. Sometimes there are inter-observer correlation, kappa statistics. So there are different statistics for different type of research question for validation. They can be used. But whatever I mentioned, that is the simplest one. Go for experts first, then do pre-testing. Then, if it is required, if you feel like that variables are very much related to each other, which normally doesn't happen, but in clinical studies, like if I'm looking out for prediction of death among chronic liver disease patients, so there might be bilirubin, total bilirubin, indirect bilirubin. So when there are something which are very much related to each other, at that time you may go for exploratory factor analysis also. Otherwise, simple content validation by experts, pre-testing will help you to make a validity tool.
Yes, sir. So Shelly is asking, can you please explain about data saturation?
Data saturation, the word this is used when you do qualitative study designs. Like I want to get information about hepatitis B birth dose related problems, why the coverage is that poor. So I thought of that I'll include around 40 ANMs, I'll include around 40 mothers, and then I'll interview these people by using in-depth interview, and I have a interview schedule also. So I started interviewing one by one these people. So after, if I give the example of ANMs, I started interviewing one by one ANM, and after interviewing 28 ANMs, I feel like now no new information I'm getting. Every time they are repeating the same problems. So that time I can feel like I can mention that Though I planned to interview 40 ANMs, but I felt that my data was saturated. After interviewing 28 ANMs, there was no new information coming up, so I gave up at that time, and data saturation was achieved in 2028. So this is data saturation.
Yes, sir. Now, another question is, how is data collection done in methodological studies?
In methodological studies, all studies are methodological studies, and data collection, mainly data collection always depends upon your primary objective. If you like, if I say I'm doing a cross-section study, then data collection is mainly about the data which is going to describe something, describe a population, because it's a descriptive study design. If I'm doing an analytical study design, that means I have to collect data from two different groups, and it also depends on the type of data also, whether it's a categorical data, whether it's a continuous data, whether I need to do some measurements, whether I need to some biochemical tests, whether I need to do some radiological findings. So depending upon the type of data and type of study design, you have to do data collection. And there are different methodological studies, and according to different studies, different objectives, different type of data, and then you have to plan.
So it depends on your objectives. So, and what do you want to?
Objectives and type of data.
You can do the data collection. Another question is, from focus group, if we select a sample for the interview, then what type of technique it is?
Normally, we say for focus group discussion, we should have a group of 6 to 10 people. So there is no sample size calculation for focus group discussion. This is something which is uniformly defined at 6 to 10 people. But if you feel like you may increase up to, I'll say 15, or you can have lowest is 6. So there is no sample size calculation method for focus group discussion. Ideally, it should be 6 to 10 people, relevant people who you feel that they comes in that homogeneous group with a similar kind of experience, similar kind of lifestyle, and they not affect the flow of the discussion during the focus. So those people, they can be sit, you can make them sit together, then you can start your focus group discussion. So no fixed numbers, but 6 to 10 is good.
Okay. So can you suggest some national and international sources to provide data regarding major diseases?
It depends upon the what diseases you are working on. If you're working on the diseases which are in different programs, then you have to try to contact those organizations who are running that program. Like I need data on AIDS, then I have to go for National AIDS Organization. I need data on hepatitis, the National Viral Hepatitis Program, because they have the control on that data. So depending upon the disease, if it's something which is new or which is different, like a cancer, you can go for National Cancer Registry institutes who are working on national cancer. So depending upon the disease, then you have to find out which organizations they are working on those particular diseases, who run the data, who have the control on that data, and then you can approach them, try to find out who is the nodal person, write a mail, and try to get the data.
Yeah. Another question is, if we are using government survey or a book as a secondary data in our research, do we need to take permission? And if yes, then from where?
Normally, if you are using published data, no need to take any permission, because it's already published. It's for you only. Yes, you have to acknowledge it by mentioning the reference. You have to, like when we do meta-analysis, systematic review and meta-analysis, what we do, we find out the studies, we do the data extraction, make forest plot, and publish your paper, but with the references for all. So giving references, acknowledging is sufficient.
Yes. Another person is asking, what is the time limit for structured and unstructured interview?
Time limit depend upon the number of questions. There is no time limit. Like if you're talking about time limit of filling those questions, there is no time limit. If I mean, it depends upon the person also. Like you individually, you also may take 10-15 minutes initially for the first question. You may take 7 minutes later on. So time limit, if I have understood you correctly, then there is no time limit. It depends upon the number of items, number of questions there in the structured and unstructured. Unstructured definitely takes more time than structured.
So when we are using Google Form, it is a survey or questionnaire method of data collection.
It is a questionnaire which is given online by a survey method. So don't get confused. These are something which are very much related to each other. Na? Survey, questionnaire. I mean, there are different names which are given, but I mean, take it very simple. So if you are giving a questionnaire online for a survey, so it's an online survey using questionnaire.
Okay. When are Delphi surveys done and how it is done?
Delphi surveys depends upon, like, I mean, Delphi is a type of survey when you want to find out the cause behind any particular disease or particular factor. So Delphi is something which is very basic design. I'll say not that commonly used also. So I'll not recommend Delphi because I've never done it, and I think I'll not. This is something which is very, very simple.
I think when you are making tools, etc., no, then you are giving it to experts again and again, and then you are finalizing your tool. In that time, we are using Delphi surveys. Usually in nursing studies, we are using when they are making tools, no? First draft they will make, and then they will give it to 5 people. Then again, they will revise it, and the circle will keep on going. Okay.
Okay. So I mean that means at the time of content validation, we can use Delphi survey, Delphi method.
It is.
I'm not sure, but we never use, so I'm not sure
Yeah.
about it.
Okay. See, people are asking a lot of questions like how much time we need to spend on the experimental studies. It all depends on your objectives and the time what you have with you for your study. So that will decide how much time you are going to spend on one person. What is your protocol like that? And how many questions should be there in a qualitative study tool?
I mean, it
There is no
depends
such
upon your
definitive
objective.
guideline, I think. No? Yeah.
Depending on objective, like if it's
Yeah.
something you want to very go into in-depth information, that you can have multiple questions. If you want to have some basic idea about answer about your question, you can have some limited questions.
So one more thing, someone is asking again regarding the secondary data, that when the secondary data, when we are taking regarding human subjects, then should we take consent? I think it is already published. Then we
No consent is required for secondary data because it's already published. So, and it's not feasible also. How can you go back and find out those people?
One more thing is nominal group technique is a type of focused group discussion. Can you please explain this?
Nominal.
I think nominal is a type of variable, isn't it?
Nominal is a type of variable, or it's a type of variable. When we talk about data, so data can be nominal, can be ordinal, can be interval, can be scale. So that time, but yes, there's a technique which is known as normal group technique, which is a structured variation of a small group discussion to reach to consensus. So I'm not sure, but we never used it. But I know it's a type of focus group discussion is only when you keep a group small and you want to reach to some consensus, when you get confused in the focus group discussion, and you feel like you need to have a small group discussion. So that's a basic understanding of nominal group technique.
Okay, sir. One more person is asking, in focus group, do we have to do audio only or in the questionnaire form?
No, you can go for it's not questionnaire form. It's never questionnaire form. You can have a guideline or schedule for that particular discussion. That this is how you are going to go with the discussion. But it's never questionnaire. Yes, you do for audio recording, so that you can later on you can listen it, and you can write down what they have said, and then we call it transcript. And after writing that the whole transcript, you just highlight the important statements which are repeatedly coming out and which you feel they are important.
Yeah. So one more question, whether the standardized tool can be modified for the study?
If there's a standardized tool and you want to modify it, even if you want to change language, then also you need to go for validation. So it can be done. If you can do modifications if you feel like, but if you mention that modification, then you have to go for validation.
Go for validation. Yeah. Okay, there is one more question. Can I take samples in odd and even number? For example, in experimental group, the samples are in odd number, and in control group, they are in even number series in case of quasi-experimental research study.
When we call it quasi-experimental, that means we are not going for randomization. So if you still want to do this odd even Kejriwal approach, then I think you can go for it. Otherwise, normally when we say quasi experimental, it itself means that we are not going to do any randomization. And but I think it can be it can be used.
Okay, sir, those were the questions. So thank you so much for patiently answering all the questions and clarifying all the doubts. So it was a very knowledgeable session. So sir has very beautifully explained about different types of the variables. What is the difference between primary and the secondary data, and what are the different methods of data collection, and what are the advantages and disadvantages of each method. So hope all of you have gained new knowledge through this presentation. Thank you so much, sir, for today's presentation. And thank you.
Thank you.
Thank you, the organizers, for giving us the opportunity to share the knowledge with us. Thank you.
Thank you. Bye-bye.
Thank you, madam, for moderating the session today. I also take this opportunity to thank the speaker today, Dr. Ajeet Bhadoria, for giving his valuable time despite his busy schedule, as well as the festival day, as well as the Sunday afternoon. And despite being the Sunday afternoon and festival day, we had around 400 participants today. The session went well. And I thank everyone, the participant, the speaker, and the moderator on behalf of the president, Dr. Lata Venkateshan, the president of CNRS. Thank you.
Thank you. Thank you so much.